2025 Benefit Enhancements.
The annual benefit review is robust, with deliberations commencing in January of each year. There are certain principles for the annual review, which include
enhancing benefits or innovation. These come at a cost, but it is necessary to remain competitive and be the medical scheme of choice for the financial services sector.
optimizing risk management to keep contribution increases low,
Considering a tiered differentiation in benefits between plans, especially for the discretionary benefits where members perceive value and would therefore consider higher premiums justifiable.
lowering out-of-pocket payments,
Improving member experience.
and ensuring alignment of benefits with clinical best practices. The 2025 benefit enhancements were informed by several considerations. Firstly, it was a fine balancing act between benefit enhancements, affordability, inflationary challenges, and scheme sustainability. During the benefit review deliberations, part of the discussions revolved around what was learned from the pandemic, with a focus on digital and remote healthcare initiatives and appropriate settings of care. In addition, principles of value-based care and contracting, clinical risk management, and clinical best practices were central to the discussions to ensure optimal outcomes and better quality of care for our members. And don't forget, the member-centric philosophy of Bankmed is always top of mind, along with employer group requests. As a medical scheme, Bankmed's strategy is one of health and wellness, with a massive focus on wellness itself. This includes the screening for and prevention of disease, as the early identification of disease and enrollment into our managed care programs is central to our strategy. We are excited to share the wellness screening enhancements for 2025.
The first enhancement for 2025 is the implementation of a cardiometabolic risk reduction program. It entails that when a member is flagged as a high risk for either hypertension, diabetes, and/or hyperlipidemia post-PHA screening, they are encouraged to consult a GP to confirm the diagnosis. In 2024, post-PHA GPA consultation is subject to day-to-day benefits, but in 2025, that will change. Members will get one GP consultation from the risk benefit within a specified timeframe post-PHA if they are rated high risk. Once the diagnosis is confirmed, the member can enroll onto chronic medication and the managed care program where available. In addition, a basket of care will open up, allowing the member to be followed up on for the chronic condition. In 2024, the PHA benefit is applicable to members 18 years and older. In 2025, though, with the goal to identify risks earlier, including a high BMI, and so that members can access the additional risk benefits provided if they are identified as high risk, the benefit has been extended to include members 16 years and older.
The next enhancement is the Post-Engagement Wellness Management Program. It includes a child obesity screening assessment for beneficiaries aged 9 to 15. Childhood obesity has reached epidemic levels in both developed and developing countries. It is a global problem that is steadily affecting many low and middle-income countries, particularly in urban settings. Being overweight or obese during childhood is known to have a significant impact on both a child's physical and psychological health. Overweight and obese children are likely to stay obese into adulthood and more likely to develop non-communicable diseases like diabetes and cardiovascular diseases at a younger age. The mechanisms of obesity development is not fully understood, and it is believed to be a disorder with multiple causes. Environmental factors, lifestyle preferences, and cultural environment play pivotal roles in the rising prevalence of obesity worldwide. An online screening tool will be available to assess children for the risk of childhood obesity. If rated as high risk, the child will have access to the same follow-ups as an adult, including a dietitian, biokineticist, and GP.
Continuous glucose monitoring for type 2 diabetics. The Continuous Glucose Monitoring or CGM initiative for type 2 diabetics is intended to expand care in line with new treatment modalities and to improve healthcare quality and outcomes. A 1% reduction in HbA1c in type 2 diabetics results in 19% reduction in cataracts, a 43% reduction in amputations or death due to peripheral vascular disease, a 14% reduction in myocardial infarction, and a 16% reduction in heart failure. In 2024, this initiative was only available to members registered for type 1 diabetes, but in 2025, it will be expanded to type 2 diabetics who require intensive insulin therapy, which is defined as taking a bolus insulin before every meal and a basal insulin once daily. Epilogue.
Epilogue has developed a digital tool for people dealing with advanced illnesses. The tool uses behavioral science and was developed in collaboration with a leading expert, Professor Dan Ariely, Professor of Psychology and Behavioral Economics at Duke University. The Epilogue tool can engage digitally with Bankmed members to build trusting relationships and uses behavioral economics to engage with people making transitions to palliative or needs-based care. Using the tool takes a user on a journey that provides them with early and personalized support based on what they want, taking into consideration their life circumstances. It is patient-centric, holistic, and designed specifically for a person diagnosed with advanced illness. The intention is to shift them from managing their disease to rather managing their life and transitions in care, focusing on quality of life. Epilogue also provides access to compassionate technology, which assists in driving higher adoption rates.
Epilogue Journey uses a WhatsApp interface to engage and message members in a way familiar to them. Epilogue's objective is to reach more members and to provide them with support in their times of need through the introduction of a digital tool. It aims to engage members earlier in their healthcare and wellness journey, and furthermore wants to increase enrollment in the Advanced Illness Member Support Program and the Advanced Illness Benefit.
Mental Health Management Program Enhancements. Currently, depression is the only condition managed by the Mental Health Management Program, but in 2025, the program will be expanded to include generalized anxiety disorder. Members claiming for anxiety identified through a defined list of ICD-10 codes will be able to access care when they are enrolled by their Premier Plus GP or network psychologist upon completion of the GAD-7 assessment. Once members meet the criteria, they can access a range of benefits in the basket of care paid from risk. This includes 3 GP consultations, prescribed antidepressants for 6 months and/or diazepam for 10 days, up to 3 individual psychotherapy sessions or 9 group therapy sessions, and 1 course of internet-based cognitive behavioral therapy.
At Bankmed, we believe early identification of depression and anxiety is a key risk reduction strategy. This can be achieved with an emphasis on mental well-being screening and early intervention when a member is flagged as high risk for these conditions. This initiative will introduce a single risk-funded consult with a Premier Plus GP or network psychologist if the member has completed a PHQ-9 or GAD-7 assessment, has a score of greater than 9 and is not currently enrolled on the Mental Health Management Program or registered for depression. The nature of the consultation will be determined by the severity of the shown symptoms, with a score of between 10 and 14 garnering a virtual consult and a score of 15 or above a face-to-face consultation.
The Premier Plus GP and network psychologist will be able to assess the member, make a diagnosis and register them on the appropriate benefit and/or program where applicable. The process will be facilitated by a call from a mental health coach. The Bankmed member will then receive communication via WhatsApp and/or email to facilitate the utilization of this consultation.
Enhancements to the dementia benefit. Dementia is a general term for the loss of memory, language, problem-solving, and other thinking capabilities that are severe enough to impact daily life. Bankmed has enhanced its dementia benefit for 2025 in several ways. For one, chronic cover for Alzheimer's has been extended to members of the traditional plan who meet clinical entry criteria subject to the clinical protocols. Furthermore, a consultation from risk for an occupational therapist or psychologist will be made available in those areas where occupational therapists are not available for members aged 65 years and older. And lastly, a comprehensive cognitive assessment will be carried out, paid from risk. This will be done by the occupational therapist or psychologist. The outcome of the screening for dementia is based on the score after the cognitive assessment is completed. If there is no sign of Alzheimer's being present, nothing further is required. If there is mid or early Alzheimer's detected, there will be annual follow-ups with the occupational therapist or a psychologist who will be required to monitor the progression of the disease. In the case of moderate to severe Alzheimer's being detected, the member will be referred to a neurologist, physician or psychiatrist to assess the patient and decide on the next steps in the management of the condition.
Myasthenia gravis chronic cover enhancement. Myasthenia gravis is a chronic autoimmune disease in which antibodies destroy the communication between nerves and muscle, resulting in weakness of the skeletal muscles. The disorder affects the voluntary muscles of the body, especially those that control the eyes, mouth, throat, and limbs. It is not a PMB-CDL condition. As a result, the chronic medication is currently subject to the chronic limit together with other conditions the member may have, including PMB conditions. In 2025, chronic medication for myasthenia gravis will be paid in full, subject to the clinical protocols and clinical appropriateness, and have no impact on the chronic limit.
Speech processor upgrade benefit enhancement. The speech processor is a component of the cochlear implant, and currently Bankmed members on the top 3 plans of the medical scheme have access to the upgrade benefit for this processor. For 2025, this benefit has been enhanced. Presently, the benefit is 80% of the scheme rate up to 161,470 Rand over a 3-year cycle. This benefit will be enhanced to 100% of the scheme rate in 2025, subject to the limit. The cycle was a 5-year cycle previously until the 3-year cycle change was tabled as an enhancement and approved at the July 2022 Benefit Design Board meeting. It was implemented on January 1st, 2023. The original proposal for the replacement cycle of the processors to be shortened was made to align with changes in the underlying technology at the time.
This concludes the 2025 Benefit Enhancements. Bankmed, yours in good health.